Harris County, Lina Hidalgo updating the county's response to COVID-19. Let's listen in.
I'm here this morning with Dr. Shaw, the director of our Harris County Public Health Department, Dr. Porsa, CEO of our Harris Health System, Dr. Mark Boom, CEO of Methodist Hospital System, and Dr. Paul Klotman, the CEO of Baylor College of Medicine. They are the last three are all part of the group of doctors in the Texas Medical Center who've been working together, all the CEOs, to coordinate both patient care and help inform our broader strategy. Let me start with highlighting some news that underscores why we're here today. Yesterday, we had 97 new cases in Harris County outside the city of Houston, 1 new death. In total, between the city of Houston and Harris County, we've crossed the 6,300 case mark. Yesterday, Texas also reported 50 more deaths from this virus, the most in any one day since mid-March. Statewide, we added more than 1,000 new cases of COVID-19, the biggest one-day jump in 3 weeks. I'll be the first to tell you that one day of data doesn't make a trend, but it's a grim reminder that this virus doesn't respect dates on a calendar. It's impossible to pull a date out of thin air and say to the virus, we're ready for you to go away now. That's not how it works. And that's not how any of this works. We can't allow ourselves to be desensitized to what's happening, to lose our sense of humanity. 50 Texans, brothers, sisters, parents, grandparents, sons, and daughters had their lives cut short yesterday from a single invisible killer that still lurks amongst us. Look, I understand how folks feel. I, as you, recognize that the sooner we get the economy up and running again, the fastest we can get our society back on track and recover from this nightmare. I want our economy and our society back open yesterday, as much as everyone. People are hurting, children are missing, they're playing with their friends, families miss each other, folks miss major milestones like weddings, birthdays, graduations, anniversaries. Business owners have lost their lives' work. Workers are struggling just to get by. But we can't ignore what's right around the corner, and that is the resurgence of a virus that can knock us back down and put us right back where we began. There are some who see today as a day of celebration or back to business as usual. My message to them is not so fast. From what we've seen in the news, most folks plan on staying home. Some people are saying, not the majority, but a few people, just a few, are making calls to ignore science, saying that some amount of death is okay in the name of our economy. I'm tired, I'm done, I'm opening up. But that's a false dichotomy. That's not how it works. Reopening doesn't mean mission accomplished. It doesn't mean that the virus goes away. If the virus spreads like wildfire and the hospitals run out of space or are running out of space again, things are going to have to shut back down again. If we do the reopening step by step, carefully, there's a chance of succeeding by slowly reopening. If we're able to contain and we're able to test and we're able to trace. There's been some confusion as to who's open and who's closed. The Attorney General issued a clarifying letter just this morning. If you are not essential, as defined by the order I issued or the governor's order, and you are not reopened as classified under the governor's order, the 3 reopenings he listed, you should be closed. I'll be reissuing my order later today to conform with the governor's order and the Attorney General's clarification, and that is what I've shared. Most importantly, just because you can open doesn't mean you should. Earlier this week, I announced 3 steps county government will take to contain the virus as our order moves forward, some businesses begin to open. It's a strategy focused on expanding testing, tracing, and treatment, ambitious recruitment and deployment of tracers, of tests, which we are doing behind the scenes day and night, every single day, to get this up and running and help our community contain as best and aggressively as humanly possible. My work is not done, our team's work is not done, and yours is not either. And today we're announcing the fourth T in our strategy. That T involves every single resident in Harris County, and that is teamwork. I went to the front lines yesterday to LBJ Hospital, one of our major public hospitals here in Harris County. I visited with doctors and nurses in their COVID unit who are sacrificing every day, many of whom are self-quarantining from their families, putting in long hours, nervous about contracting the virus. We have to do everything we can to let them do their jobs and let them save lives. Everything we can do is to keep those doctors and nurses from getting overwhelmed so they can do their jobs, protect the lives of people, not just those who have coronavirus, but lives of folks with any condition that means they need to be in the hospital. If these doctors and these nurses get overwhelmed, people die en masse, plain and simple. Dr. Porsa, here as the CEO of Harris Health System, our public hospital system, represents these doctors and nurses, brave doctors who are putting in the work, brave nurses, deeply committed, whose work we need to be able to protect. He, as all of us, needs us, you at home, everybody, to continue to do our part to keep our healthcare system afloat. And so Dr. Porsa will go over the three parts that make up this teamwork effort. I will then repeat remarks in Spanish, and we'll hear from the other speakers here. Dr. Porsa.
Good morning. And thank you again, Josh Hidalgo, for your continued forward-thinking and strong leadership. I would like to start, first and foremost, to once again thank the healthcare workers at Harris Health and across the Texas Medical Center and all the rest of the healthcare delivery systems in this area, our first responders, and other essential workers who have been on the front lines and are the heroes of this story. Houston, we have managed to flatten the curve, and that is great news. I'm cautiously optimistic that we may have done well in our efforts to contain the coronavirus, but our work is far from over. Our success so far has not come easy or cheap. You have suffered much in terms of sickness, lost lives, lost wages, lost businesses, and unimaginable emotional and psychological stress over these past few weeks. Because of all your sacrifices, we are now at a point that we can realistically talk about reopening our economy and return to life as we once knew it, or something close to it. I want to congratulate you for your success, for your achievement. You have done so much and have given so much of yourselves to get to this point. But I also want to ask you to please, as you just heard from the judge, please remain vigilant and on guard. As I already mentioned, the struggle against the coronavirus pandemic is not over. We are continuing to see new cases of COVID-19 across our region and our hospitals. And people are continuing to die because of this pandemic. Thanks to you, these numbers are dramatically smaller than just a few weeks ago, and considerably lower than what they could have been if not for all your hard work and sacrifice. Nearly 2 months ago, this community set out to flatten the curve. and you have done so. I want to remind everybody that our call to action a couple of months ago was the evidence of a community transmission of the coronavirus to just a handful of people. As I already mentioned today, we are still experiencing entirely way too many COVID-19 cases in our community to become non-committal. So as we take a moment to appreciate our collective success in flattening the curve, I want us to be mindful of the danger that remains and ask everyone to join me to double down on doing absolutely everything that we can as we take steps to reclaim our lives. If you can stay home, please do so as much as possible. And practice immaculate hygiene, including covering your cough and sneeze, and washing your hands frequently. And distancing yourself as much as possible if you're sick. When in public, please continue to cover your face and frequently wash or sanitize your hands. In public areas such as shops and restaurants, in addition to covering your face and washing your hands frequently, please continue to observe social distancing by staying at least 6 feet apart. And as the judge already mentioned, really important, I'm asking everybody to please support a contact tracing that, in addition to testing, is going to be integral to ensuring our continued success. We are all in this together. My actions impact you, and your actions impact me. And remember that social distancing does not equate to social isolation. It is beautiful outside. Please enjoy the outdoors. However, do so in a responsible way. We have come a very long way and have paid a very heavy price to be in this position. Please do not let your success slip away, and follow these recommendations. May God bless us all, and thank you again.
Thank you so much, Dr. Porsa, for those remarks. We've done, as he said, incredibly well in this. Just a little bit over a week ago, a few weeks ago, they were saying that we were the next domino to fall, another big city that COVID would devastate. But they didn't know about the people of Harris County. They didn't know about our grit and our determination. What we are not is lucky or special. We've gone through this because you've responded and heeded warnings, not because we have any special immunity to the virus here. We've gone through this because of the leaders in this community. And so I'm asking everyone, from community members to community leaders, faith leaders, business owners, heads of households, you've all saved lives by example. Right now, we need your help continuing to, as we have work and play virtually. If you don't need to go out, please don't. You can still support businesses through delivery, through takeout. Use those face coverings and support our contact tracers. Let's hear from, or let me repeat the remarks in Spanish, then we'll hear from Dr. Shah and Dr. Bloom. And
You've been listening to Harris County Judge Lina Hidalgo give an update on the response to coronavirus in our area. The judge encouraging residents to stay home today, even as phase 1 of the economy reopens. Businesses now open at 25% capacity. Some businesses. We also heard from Dr. Porsa, President and CEO of Harris Health System. He says our area is still experiencing too many cases to be non-committal moving forward. He is asking the public to be mindful of the danger that remains, and is asking people as they go about their business today to double down and do what they can to prevent the spread of this virus. You can continue to watch the judge's Spanish translation and the rest of this news conference on click2houston.com. We will continue to listen to this and bring you any updates coming up at noon. Stay with us. We'll be right back.